Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hello and welcome to Podcast. My name's Hazel Dockery from Practice Plan, and with me today is Lisa Andrews. We're talking about a resource that she's developed for parents with children with ADHD. So Lisa, please introduce, it's lovely to have you here. So please just introduce yourself, tell us a bit more about who you are and what you do.
Thank you, Hazel. Yep. So my name is Lisa Andrews, or Lisa Andrews Davies, as I've become to known because of I've just never got rid of my maiden name. I am a dental nurse in special needs in Hertfordshire Special Care Dental Service. I've been doing this for 25 plus years. I started my working life in the forces as a nurse many years ago, and when I come out I didn't know what I was going to do with my life. My nursing that I'd done in the forces wasn't really a qualification in Civvy Street, so I had to kind of find something else. And I literally fell into dental nursing. I started in a very lovely little practice in St Albans, and my lovely dentist put me through all my dental nursing qualifications, and I just loved dentistry from then on. I just fell in love with the whole idea of it, and then I found this fantastic job within the special care system, and that's just been my absolute niche ever since, and I've never stopped loving doing what I do. We see lots of patients with special needs, including autism, ADHD, learning disabilities, people with very severe and profound medical issues. So basically anybody that nobody else within the dental world could see for whatever reason. One of the other things that I've really taken a real passion and interest in is ADHD. And I noticed lots of patients with ADHD were coming to us and being very anxious. The parents didn't know what to do. There was lots of information that wasn't being sent to them or given to them. So there was an opportunity to do a research with Colgate, the Davies Award, and I applied. I never ever thought I would win it, but I did. Bearing in mind I have no actual formal sort of research background, and I had a very lovely dentist called Michelle Stennett who has supported me through it, and I did my research. I went ahead with it, and as a result I've produced this resource. I also have a very much of a personal interest in ADHD and autism, especially because my son was diagnosed with it when he was about 6 or 7 years old. And some of the medication they were given, a stimulant medication, I had no idea that it was going to cause him to have an appetite suppressant effect.
Oh.
And then at the end of the day, a lot of these children fail to thrive because they're not getting the calories in, because during the day through school, they're having this stimulant which isn't allowing them to eat because they're not feeling hungry. Yeah. And then I'm just told to give them lots of high calorific foods to build up their weight. And I'm thinking, and let them eat when they want, when they want and how they want. And with my dental nursing head on, I'm like, why would I let my child eat lots of high calorie foods and sweets and naughty things for their teeth? And this is where it kind of developed, and this is why I've become very passionate about getting information out there for parents to try and prevent other children and parents not having that information that they need to try and prevent dental decay for these children.
Yeah, it's a bit of a minefield, isn't it? Picking your way through when you've had a diagnosis. I mean, my children are no longer children, they're adults, but my daughter was only diagnosed at the age of about 27. And everything makes sense now. So you've developed this resource. It's a website, isn't it? And
it is, yeah.
It goes through the various, are these frequently asked questions, really?
They are. So part of the research is I went out through, I don't know if anyone is aware of it, there's a support group called Space, and there was one particularly called Space Hertfordshire. And so I went to them because I joined them when I found out my son was ADHD, because I didn't know. I mean, even though I'd worked with children with ADHD, I thought I knew a lot, but actually living it and working it is very different, I think.
Yeah.
And at the end of the day, you're giving these parents this advice, oh, just don't give them sweets, just don't give them that. But then they're getting conflicting advice from
Yeah.
other professionals because they're failing to thrive. And I just thought, and the parents are saying, well, why can't you stop them? Why can't I give them sweets? My paediatrician told me I need to give them this. Or why can't they have braces? So I kind of went to them, and yes, a child with ADHD can have braces, but a lot of children with ADHD, as we know, have sensory issues. So braces aren't ideal, or their cleaning isn't very good. And that's, again, as part of the ADHD. So I went to parents and said, what questions would you like? And I did a survey through Space, and the responses were phenomenal. I think a lot of people were saying these were the questions that they really wanted to know. So as a result, I sort of looked at all these people's questions and created the resource. So these are things that parents wanted to know and needed to know, and they didn't understand the consequences or what they can do to support their child. So I think it was really helpful. And then I co-wrote some of the actual advice with a couple of parents that have got children with ADHD as well. So they too got involved. And also to bear in mind that if your child is autistic ADHD, the chances are the parents are as well. So you need to make the resource acceptable to them to read as well. Because if it's very long and wordy, someone with ADHD is not going to sit and read that. So I wanted the resource to be very short, sharp, and very to the point information. And that's how it kind of grew. And then I've sent, and then parents with children with ADHD also looked at it and said, yes, that's great. And they also said, oh, yes, actually, I am actually ADHD as well. So,
Wow.
So it's really interesting.
Yeah, that hadn't occurred to me, to be honest. Maybe I should get myself checked.
Well, I'm the same. I do feel the same.
Yeah. But visually, it's really good. Your website, it's all very nice and clear, but it's also very appealing visually. Was that another conscious thing that you developed?
It was, and I also looked at colours, because one of the things that we discussed with some of the parents of the children with ADHD was, what colours do you like? Because there's certain colours that are not appealing to someone that's neurodiverse.
Yeah.
So that was the other reason, finding the colouring and scheme that worked for them was really, really important. And I wanted for the parents to see it and think, yes, I can sit and read this. And that's how I wanted it to be. Because otherwise, what's the point if they're not going to read it? If you're given a great big leaflet, they're just going to look at it and throw it in the bin like we all do.
Yeah.
And as a busy parent as well, as you know, sometimes being a parent and working, you haven't got time to be reading a big, long, wordy leaflet. But this is all available online. You can click on it and be like, oh yes, and it takes you straight to it. And that was my ultimate aim, that it was easy for both parents but also for young people to read as well.
It is very easy to navigate. I've had a look. Now, one of the things that I as a non, as far as I'm aware, neurodivergent person, you don't think textures don't bother me so much, but it's really quite prominent, isn't it, with people with ADHD? So if you can't, toothpaste, if you're just using one of the normal pastes, it's probably got quite a gritty almost texture, hasn't it?
Yeah. And again, some children with ADHD, they also describe toothpaste as gritty, but also spicy, as in the mint. So actually, if the parents just know that there is actually flavourless and foamless toothpaste out there, but also there's no reason why you can't use the fruity flavours as long as it's got the appropriate amount of fluoride in it. And the parents are like, oh, so they don't have to use my adult toothpaste. Like, no, you can use the strawberry sundae one that you've been buying for the last 6 years, as long as it said the right amount of fluoride on it, it's fine. And I think it's really important that parents realise, and they're not failing by not making their child use an adult toothpaste. And so I want them to understand that, like you said, and also that you could use a gel maybe rather than a paste, because like you said, the textures can be really important. And these children could refuse to brush purely because of the flavour or the texture. So it's just sort of navigating the options, I think, and that's what I wanted it to reflect, that it was navigating options.
Yeah, I mean, I suppose really, quite often, if children have been diagnosed with ADHD, they might, parents might be trying to deal with education. The last thing they need is a fight about
Toothbrushing.
oral healthcare and
Yeah,
toothbrushing and things like that. So, the suggestions of ways to make it easier and more acceptable to them, I'm sure are brilliant. Now, as part of oral healthcare maintenance, of course, there are trips to the dentist, aren't
yeah.
there? So you've got a section on that as well. Sort of, what would your top tips on that one be, really?
But I think the most important thing is to find a dentist that your child likes. Maybe
Mm,
frequent visits are very important. And actually giving that child the autonomy to actually say, I can't do it. Um, and actually referring them appropriately if that's what they need. There are special care services out there like myself with special care dental service in Hertfordshire, and that every county has these.
mm,
But sometimes a child can go to a general dentist and be absolutely fine, and I think that's really important. But sometimes it's about acclimatizing and familiarity and frequency. And also, if the general dentist has a bit of an understanding, again, general dentists may not have the time or the understanding of ADHD, and these children can come across quite difficult. Sometimes the parents are flustered because they've had an awful time trying to get that child to that dental appointment.
yeah,
And that can be really stressful. So it's just having that understanding, and maybe preparing your child to go to the dentist, maybe asking for a social story can be quite useful.
mm,
And asking the dentist if they would send a picture of themselves, or just let the parent go in and do a little video of the place before the child goes in. So just making it as friendly and as easy as possible. And also for parents not to feel judged and not to feel guilty if their child has got dental decay, or they're kicked off because the child's having a moment or a meltdown. It needs to be a non-judgmental sort of area for that parent to understand that they're battling other things as well. And like you say, it's pointless me going to a parent, well, you can't give your child sweets, you must brush their teeth twice a day, you must do this, you must do that. Because in reality, these parents are battling other things as well,
yeah,
lots of other things, even getting
yeah,
their child to school every day, as I do on a daily basis. And sometimes the last thing you want to do is have a fight about brushing. You're trying to navigate the whole of the education system and the medical system and everything else. And sometimes just brushing their teeth is the last thing that you want to have a battle about. So I think it's about not having that guilt, letting that child choose to brush their teeth at a different time of the day if that's
mm,
what works.
yeah,
It's just like learning. And I think that's hopefully that's what people would get from my resource is the feeling that they're not alone. There are people out there that can help, and hopefully just by taking up some simple tips might make a difference. Brushing apps are a great idea as well. Again, for someone with ADHD, 2 minutes is an awful long time, or
it
even
is for someone
children.
without ADHD, to
Yeah,
be
yeah,
honest.
yeah. And especially if you're doing something that's very sensory and they don't like that feeling, a brushing app's a great thing. They're really a good tool, or a brushing chart, just a reward chart, little things like that, just to reward the behaviour,
Yeah,
can be really helpful. And also, if their child refuses to brush their teeth, try, but don't beat yourself up. But just do keep doing it, and keep offering, and keep frequently saying, we're going to brush your teeth. And
mm,
eventually the child will become, oh, this is what we have to do. And
yeah,
it becomes part of the routine.
yeah, yes, yes. I mean, it's a difficult thing to navigate, isn't it, really? Because
Yeah,
you don't want your child to have tooth decay, but as you say, you've got other things. If they're failing to thrive, I suppose the temptation, it's the problem with high calorie foods is quite often they're sugary,
they're
aren't they?
sugary. Yeah.
Yeah, but you actually mentioned a few on your resource that are
Yeah.
high calorie but not sugary.
Yeah, yeah, and also I do appreciate as well with children with ADHD, they're often quite picky eaters.
Yeah,
So, and often that they go for the sugary things because they need that dopamine rush. And
yeah,
that's the other thing that people have to understand. It's not because the child's just eating lots of sweeties, it's because they're looking for that ultimate rush. That's what
yeah,
they want.
yeah,
And that's what chocolate or sweets give to them. So subconsciously they're grabbing for these things that we know are bad for them. But it's just trying to say, yes, you can have all these things, but have them with your meals. That's the secret. And that's what I always try to say to people. Don't stop your child having all these naughty things. Have them, but just have them at a mealtime. I mean, when my son started to fail to thrive, I was giving him all these sweets. My husband looked at me and said I was like crazy. I was saying he was eating his dinner, which was often turkey dinosaurs and chips, because that's what he really loved. And then afterwards I'd be saying, have some ice cream, have some sweets, have some chocolate, have some this. And my husband was like, what are you doing? I was like, just trying to fatten him up. And he sort of like, but I said, but it's giving him the calories without damaging to his teeth. And it's just about keeping those sugary meals to 3 times a day. That's simple information, and choosing to snack on things that are not sort of dangerous to your teeth, like bread and butter, toast and butter. I mean, put the butter on as thick as you like, it's great. Fresh cream, cheese. There's a lot of things out there that you can give to your child that are good, healthy snacks, and also will be getting the calories in. I mean, my son, I used to give him, and I still do to this day, I give him porridge in the morning with full fat cream and full fat gold top milk. So that's what he has. I mean, actually, people are like, oh my God, but it keeps his calories up, and that keeps him going for the whole day.
Yeah.
And when he comes home, but I mean, it does smell and look delicious. I've not tried it, but he seems to love it. So little things like that, gold top milk with fresh cream. Why not? Give them their porridge, it's fine, or giving them cereal in the morning before they have their medication. My son loves custard, so I make him custard with fresh cream in the evenings. Gold top milk and fresh cream.
That is my idea of heaven, custard and me. Yes.
Could you imagine, with fresh cream and top? It's just delicious. And so you can get the calories in.
Yeah, you can. I always think that people who are neurodivergent, it's a bit like trying to get a quart into a pint pot.
Absolutely.
It's not the liquid that's the problem, it's the size of the pot.
Yes.
And so, there's nothing wrong as such with someone who is neurodivergent. It's just that the world doesn't quite work the way they need it
with
to.
them. And again, this is what a lot of parents will be navigating with the education system, as we hear daily. I mean, I too have battled through it, and to get his EHCP was an absolute nightmare. And sometimes, so these parents are often battling these things as well. So there's so much that as a parent that you're dealing with, and then I think that's why I think the resource is so useful for parents to just look and think, okay, so I can do this. He can have his sweeties, but have them as his pudding. It's okay. And at school, perhaps try and get the teachers to give them like gold top milk instead of giving them full fat milkshakes and things. There's lots of options out there. So it's just trying to find a way around it without causing too much stress for everybody. And I think that's the other thing. To deal with. And like you're saying, trying to fit a neurodivergent person into a neurotypical world is really difficult. And for a neurotypical person to live in a neurodivergent world, it's very difficult. So I think it's really hard. Like you say, it's like trying to squeeze the liquid into a pot, and it's not easy.
No, it's not. But I suppose if you can crack the oral health thing, then that's a big tick off your list, isn't it? It's something you really don't have to worry about, because then you don't have to worry about caries and further treatment and further trauma and further upset.
Absolutely. And children with ADHD are more likely to have trauma just because they run around mad, especially as little ones. So you've got to deal with that as well. And I think if you just have a good idea of what you can do, and actually on the resource it does tell you what to do if your child does knock out a tooth, which I think is a really useful tool for any parent. And just knowing that if you can reimplant it if it's an adult tooth, you can, or just pick up the tooth, what to do with it, and take your child straight to the dentist or to an emergency centre where they would be able to reimplant it. And actually schools need to know this more as well. There's so many people that simple things that can be done to reduce the need for dental care for that child later on in life. And I think that's the big thing. And for children with ADHD, because of the sensitivities and the sensory issues, often they may need to have sedation or potentially general anaesthetic again, which is another trauma that if we can prevent is a big thing, and a big, it's a big, I think it's a big win for everybody.
Indeed.
And I think that's what I want it to be. I just want it to be a resource for patients and parents to be able to take control of everything, and their dental side of it. At least that's one less thing that they're going to be having to deal with.
Well, we will put a link to the website in our
please.
program notes, so that anybody who's interested can have a look and see, what's available and how great it is.
Oh, thank you. I mean, I really want it to get out there, and I think if general dentists could have access to it as well, to pass on to parents when the child comes in, the parent says, "Oh, my child's just been diagnosed, or my child has ADHD," then the dentist can say, "Well, try this resource because it might be able to give you some ideas," and in turn it will help the dentist as well, because obviously it's a lot of information for them to be having to give out, but the parent can go home and have a look, and it's like, say, hopefully as somebody that's looked through it, you found it very easy to navigate, and easy to read. And that was my ultimate aim, that it was accessible, easy to read, and interesting, but also gets the information out there. So when a parent gets, I'm hoping that this also gets given to parents at point of diagnosis to children, because you're told, "Here, your child's got ADHD, we're going to put them on this medication, off you go." You don't get all the information about how it's going to suppress. You have to read the leaflet again. When you get the medication leaflet, it's huge, long and onerous, and actually, for someone that hasn't got a medical background, if you read all the side effects, that's when you start thinking, "Oh, I'm not giving this to my child."
Oh,
But actually, one of the main side effects is that the stimulant causes the appetite suppressant. And that's the one thing that really I think is very important for taking away from it. Or the child may be looking for that dopamine rush. I think it's really important that the parent is aware of that. But let them have their things, but just choose when you have it, and try and keep top of the oral health.
Indeed. Well, I mean, it's a brilliant resource. Thank you so much for talking to us about it, Lisa. It's been great. And as I said, we'll put the link in the program notes, so that anybody who's interested and to whom it's relevant as well can have a look at it. So thank you so much for your time. It's been brilliant to talk to you, Lisa.
Thank you, Hazel. Thank you.